How you doing? My name is Malcolm Gray, and I'm here with a public service announcement about HIV/AIDS. Well, let's first start off by saying what HIV/AIDS is. HIV stands for Human Immune Deficiency Virus, and then it later turns into Acquired Immune Deficiency Syndrome, which is AIDS. HIV destroys CD4 cells, which are white blood cells that are specifically designed to fight off diseases in your body. This disease is transmitted through a plethora of ways. First, being sexual transmitted, therefore, through semen or vaginal secretion. It can also be transmitted through infected needles and syringes, and it can also be transmitted through pregnancy. Prevention of the HIV and AIDS virus is simple. You can wear condoms. You can get checked regularly if you're sexually active at your clinic, and you can practice abstinence. Now, let's talk about identifying the symptoms of HIV and AIDS. The symptoms move in stages, starting with the first stage, acute primary infection stage. It's basically like the flu. You start off with fever, rashes, sore throat. It could develop up to headaches, body aches, swollen glands, and then it goes to the second stage, which is the asymptomatic stage. This stage is a little tricky because you start feeling a lot better, symptoms go away, and it could take up to 10 years for the symptoms to come back and reveal itself. And during this 10 years, while you're feeling better as if nothing's going on, the HIV cells are replicating itself and killing more CD4 cells and killing more white blood cells, which is making your immune system weaker. Now, once your white blood cell count or your CD4 cell count dips below 200, now you're in the symptomatic HIV infection stage, which is the last stage, and now it's the AIDS stage. You begin to lose a lot of weight. You start having chronic diarrhea, night sweats, high fever. You're going to have a persistent cough, and more serious illnesses may come up because of how weak your immune system has become. As for treatment for the HIV and AIDS virus, there's really only a handful of options that you have, available to you. There's the antiretroviral treatment that includes vaccines such as 3TC, lamidine, FTC, M-tricytabine, and EFV efavirenz, and those are very, very costly. As of cures for the disease, there are none. So the best way is just prevention. The HIV and AIDS virus have been very prevalent in the state of Louisiana. Over 2,100 cases of HIV and AIDS alone has been in the Acadiana Parish. In the city of Lafayette, which is in the Acadiana Parish, there's been 683 cases of HIV and AIDS, and 17 of those being pediatric cases. As of December 31st, 2010, Louisiana has ranked third among young adults ages 20 to 24 in HIV cases. They've been ranked first for HIV diagnosis among youth ages 13 to 19. They've been ranked third among youth 13 to 19 in AIDS cases, and first among young adults aged 20 to 24 with AIDS. To add to those statistics, 57% of HIV cases in Louisiana are African American, and 56% of AIDS cases are African American. There are 30,826 people in Louisiana that is living with HIV and AIDS, and those cases have been recorded. Moving on to the United States, there's 1.2 million people in the United States that are living with it. And there's 12.8% of the 1.2 million that they don't even know that they have the HIV or AIDS virus. The best way to fight against HIV and AIDS is just to stay preventive and use the options that's always available to you, and to always make sure that you're staying up and keeping up with the latest information about the virus. So let's stay safe, let's be preventive, and let's stay educated.